Welcome to Abudoni Health Channel. The quality health tips you can trust.
Hygiene. Hygiene is a series of practices performed to preserve health. According to the World Health Organization, WHO, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. Personal hygiene refers to maintaining the body's cleanliness. Definition. Hygiene is a practice related to lifestyle, cleanliness, health and medicine. In medicine and everyday life, hygiene practices are employed as preventive measures to reduce the incidence and spreading of germs leading to disease. Home and everyday hygiene. Home hygiene pertains to the hygiene practices that prevent or minimize the spread of disease at home and other everyday settings such as social settings, public transport, the workplace, public places, etc. Good home hygiene means engaging in hygiene practices at critical points to break the chain of infection. Hand washing. Hand washing, or hand washing, also known as hand hygiene, is the act of cleaning one's hands with soap or hand wash and water to remove viruses, bacteria, microorganisms, dirt, grease, or other harmful and unwanted substances stuck to the hands. Drying of the washed hands is part of the process as wet and moist hands are more easily recontaminated. Hand hygiene is central to preventing the spread of infectious diseases in home and everyday life settings. The World Health Organization, WHO, recommends washing hands for at least 20 seconds before and after certain activities. Respiratory hygiene. Correct respiratory and hand hygiene when coughing and sneezing reduces the spread of pathogens, particularly during the cold and flu season. Carry tissues and use them to catch coughs and sneezes, or sneeze into your elbow. Hygiene in the kitchen, bathroom and toilet. Routine cleaning of hands, food, sites and surfaces, such as toilet seats and flush handles, door and tap handles, work surfaces, bath and basin surfaces, in the kitchen, bathroom and toilet rooms reduces the spread of pathogens. The infection risk from flush toilets is not high, provided they are properly maintained, although some splashing and aerosol formation can occur during flushing, particularly when someone has diarrhea. Laundry hygiene. Laundry hygiene involves practices that prevent disease and its spread via soiled clothing and household linens such as towels. Items most likely to be contaminated with pathogens are those that come into direct contact with the body, e.g., underwear, personal towels, face cloths, nappies. Cloths or other fabric items used during food preparation, or for cleaning the toilet or cleaning up material such as feces or vomit are a particular risk. Medical hygiene at home. Medical hygiene pertains to the hygiene practices that prevents or minimizes disease and the spreading of disease in relation to administering medical care to those who are infected or who are more at risk of infection in the home. Disinfectants and antibacterials in home hygiene. Chemical disinfectants are products that kill pathogens. If the product is a disinfectant, the label on the product should say, disinfectant, or, kills pathogens. Some commercial products, e.g. bleaches, even though they are technically disinfectants, say that they kill pathogens, but are not actually labeled as disinfectants. Personal hygiene. Personal hygiene involves those practices performed by an individual to care for one's bodily health and well-being through cleanliness. Motivations for personal hygiene practice include reduction of personal illness, healing from personal illness, optimal health and sense of well-being, social acceptance and prevention of spread of illness to others. Practices that are generally considered proper hygiene include showering or bathing regularly, washing hands regularly and especially before handling food, washing scalp hair, keeping hair short or removing hair, wearing clean clothing, brushing teeth, trimming fingernails and toenails, besides other practices. Some practices are gender-specific, such as by a woman during her menstruation. Toiletry bags hold body hygiene and toiletry supplies. People tend to develop a routine for attending to their personal hygiene needs. Other personal hygienic practices would include covering one's mouth when coughing, disposal of soiled tissues appropriately, making sure toilets are clean, and making sure food handling areas are clean, besides other practices. Some cultures do not kiss or shake hands to reduce transmission of bacteria by contact. Personal grooming extends personal hygiene as it pertains to the maintenance of a good personal and public appearance, which need not necessarily be hygienic. It may involve, for example, using deodorants or perfume, shaving, or combing, besides other practices. Oral hygiene. It is recommended that all healthy adults brush twice a day, softly, with the correct technique, replacing their toothbrush every few months or after a bout of illness. Sleep hygiene. Sleep hygiene is the recommended behavioral and environmental practice that is intended to promote better quality sleep. Personal care services hygiene. Personal care services hygiene pertains to the practices related to the care and use of instruments used in the administration of personal care services to people. Challenges. Excessive body hygiene is a possible sign of obsessive-compulsive disorder. Neglecting bodily hygiene, or the cleanliness of one's environment, may be a sign of major depression and other psychological disorders. Food hygiene. Culinary hygiene, or food hygiene, pertains to the practices related to food management and cooking to prevent food contamination, prevent food poisoning and minimize the transmission of disease to other foods, humans or animals. Culinary hygiene practices specify safe ways to handle, store, prepare, serve, and eat food.
Thank you for watching Abudoni Health Channel. Subscribe, like and hit the bell button for more videos.